All right, gang, we got interrupted with a call. I'm sorry. All right, so what I was saying is you have the bubble humidifier here, right? And all of the gas that comes up from the bottom here will then be moist. And I put my nasal cannula on there, okay? So that's how I would hook it up. I would screw this to the flow meter and use this as my bubble humidifier. The bubble humidifier is the only one that is used with a nasal cannula. The nasal cannula, right? All right. So I take this one off, and we're going to the next low flow system. The next low flow system is the simple mask. The simple O2 mask. Here it is. This is the simple O2 mask. It's made together, right? It's wide open. It does not have a reservoir bag. It's just a small bore tubing straight to the mask, the aerosol type mask, right? We put this on them like so. Now, notice how I'm fogging up, right? So, what are the liter flows for the simple face mask? The liter flows for simple face mask are 5 to 8 liters, right? 5 to 8 liters. So, we don't want to, if it's less than 5, I start to build up CO2, right? So, be very careful. Also, you notice it has ventilation holes to exhale, right? Just in case this comes off or gets kinked, right? If this is kinked, then I'm not getting the oxygen and I don't have a way of breathing, right? So if this gets kinked in my bed rail or under my leg or under the wheel or something like that, then I'm able to still exhale through these ports, okay? So those are little safety vents. This is the simple O2 mask. No reservoir bag, just straight up simple O2 mask, all right? If that doesn't do the job, then I go over to my partial rebreather mask. Now, the partial rebreather mask looks like the simple mask because it does not have a valve in here. See, that's wide open, right? You have this going straight to the oxygen device, right? So let's hook it up. Get my Christmas tree. All right, hold on one second. I got to get another Christmas tree. You know, I put stuff down, but I got to get a Christmas tree so we can hook this up and I can show you the flow. All right, the Christmas tree. I'm going to hook the Christmas tree up to the DISS, right? This is the DISS safety system down here after the regulator. All right. Now I'm going to hook this up to the Christmas tree. Turn this to about 10. Let my bag fill up. This is a partial rebreather. See how the bag is inflated? See, if I push it down, it fills back up because it's getting filled from this oxygen source, all right? Now, it's a partial rebreather because it does not have a one-way valve into the bag. So when I exhale, the first third of my exhale goes into the bag, right? And that first third of your exhale is your what? Anatomical what? Dead space. Your anatomical dead space is the first 1/3 that comes out of your breath when you exhale. And that goes into the bag. So when I inhale, that first 1/3 comes back from the bag, right? So you're able to rebreathe your own gas. That's why it's a partial rebreather. Can't breathe all of it, but some of it. The first 1/3 comes back into you, right? All right. Remember that it's 5 to 8 liters. I'm sorry, 5 to 8 liters on the simple mask, but this is 8 to 10. 8 to 10 liters, or if you need to, what happens? If the bag is collapsing when the patient inhales, then you need the higher flow. So let's look at it. See how I'm making it collapse? If you see your patient's bag collapsing when they inspire, then you need to increase the flow. So I'm going to increase the flow. Hear it? See, it's not collapsing completely now because I increased the flow. So that's what you would need to do. So you need to remember what the FiO2 capabilities are of a partial rebreather mask. All right. Now, if that doesn't get it, the next step would be the non-rebreather mask, right? The true non-rebreather mask, and here it is. This is the non-rebreather mask. Notice it has a one-way flap. See this little flap? It allows you to blow out, but when you suck in, it closes, so you don't get any outside air. This flap comes on this side as well, but it's removed by the hospital for safety, right? Because if I have this flap on here and this gets disconnected from the oxygen, then when I inhale, I'm gonna suffocate, okay? Because there's nothing there for me to inhale. So the difference between the partial rebreather and the non-rebreather is this one-way valve here. See how I can move it, right? Oxygen is pouring up through here, and when I exhale out of here, right? Exhale out here and out here. But when I inhale, I only get this source gas, right? And of course, yeah, this was open, so some of it's going to go in there, but this is supposed to be closed, right? Theoretically, this would be closed, right? Because it's a non-rebreather, but we only take it off for safety. We do that. The company doesn't. When they sell it, it's got it on here, okay? Because that's the only way to get very close to 100% oxygen is using the non-rebreather mask. Now, so this is the non-rebreather. Has the flap on the inside and on both sides, right? All right. Now, still low flow. This is still my low flow system. All right, the last one from the low flow system. Again, you have the nasal catheter, right? Transtracheal catheter. We don't have any of those here. Like I said, very rarely would you ever see one of those. But those also would round up our low flow devices, okay? Now, high flow devices, okay? Now we're getting into the high flow. This is where your patient has a non-consistent regulatory pattern, right? Non-consistent ventilatory pattern. Their tidal volumes are super large, or keep in mind, tidal volumes could be super shallow. Don't think just because they have a shallow breath that they need a low flow system, right? Because if the breath is very shallow or the respiratory rate is very low, then the oxygen from a low flow system starts to collect in their anatomical reservoir and mechanical reservoir. So when they do take a breath, it's a high FiO2, right? Because they're barely pulling any entrainment, right? So if their tidal volume is 150, 200, something like that, or they're breathing 10 times a minute, aside of thinking about, yeah, we need to intubate this patient, but if you're thinking about high flow or low flow, they need a high flow system. And a ventilator would be a high flow system, right? Because we want to fix their FiO2. We do not want Mr. Johnson to be breathing 10 times a minute and a tidal volume of 150 to 200 on a nasal cannula. His FiO2 would be out the roof, okay? And it will cause his PaO2 to jump up, right? And then for him, he will start to hypoventilate, which would make him become hypercapnic, right? And that's respiratory failure. CO2 out the roof, respiratory failure, right? He would die, okay? So it has to be between 300 and 700, like a regular, just think regular tidal volume and a regular respiratory rate, right? Consistently. But if it's really, really shallow, or really, really big, if he's breathing 50 times a minute or 40 times a minute, and tidal volumes look like they're 800, right? If you get a Wright's respirometer and you measure it, and their tidal volumes are 900, a liter, a whole liter, then yes, they need a high flow system. So either way, to control that FiO2, we want a high flow system, right? Now, here goes our high flow system. We'll start with the Venturi mask, right? And I want to show you a Venturi mask. Some of them have gotten fancy, right? And they come in a bag like this, right? Already put together. You saw in the lecture that some companies have the color-coded Venturi, and I'm gonna show you those as well. I have these here, okay? But the regular Venturi that they come in the mask already made, this is it right here. This is a Venturi. This is the window. This is where air entrains, right? We plug it up to the oxygen source and turn it on. Now, look at what it says. There's a little arrow here letting you know that if you want these percentages, you have to turn it on 3 liters per minute, right? And if you want these percentages, you'll need to turn it to 6 liters per minute, right? So it's kind of fancy, right? You just lift up on it and turn, right? So whatever FiO2 I want. So say I want, let's just say, what is that, 28? Yeah, 28%. Well, then I'll turn this to the 28 and drop it, right? Right there where it's pointing, going to 28%. And it says all of these FiO2s must be turned to 3 liters per minute to guarantee these FiO2s. So I would turn the flow meter to 3 liters per minute, and I would be getting 28%, no matter how they breathe, how deep, how shallow, because a high flow system could care less about your ventilatory pattern. It only, it will meet your demands no matter what, right? So this is 28%, but notice how this window's open and closed. See this window? All right, so if I open it up, see, look at that. See how it got bigger? Or see how the windows are getting closed? Less entrainment, right? So the higher the FiO2, the more closed the window. See? The higher the FiO2, the less air entrainment I can pull in, right? Because we want that FiO2 to stay potent. But if I want the FiO2 to come down, then I have to open the windows, right? And the lowest one on here is 24%, right? So, you know, just like 1 liter, right? So here it is right here, wide open, almost room air, right? And if I want more, then I start to close. See those windows close? Higher the FiO2, the more it shuts, right? That's the Venturi principle, guys. This is the mask already made. You have a large bore tubing and, of course, 1 small bore tubing. Now, don't forget about the little safety mechanism. The safety mechanism. Remember we said this was the little medicine cup? This is the aerosol medicine cup. Also the safety system to protect from bedding. So I would just push this in here like this and then hook up the actual oxygen tubing right here, right? And this goes behind the ears, right? Here it is. So now when Mr. Johnson is asleep and he has his cover over here, I don't block these ports. See, I can, if I had the cover right here and he was under the cover, right? And the cover was laying on him, well, these ports are not blocked. See, because if he's a COPDer and you block these ports, if you didn't have this on here, if you didn't have the safety mechanism on and you completely closed this off, well now what is the FiO2 going to be? If there's no air entrainment, what is the FiO2? 100%, right? So you have to be very, very careful not to block these ports, this air entrainment window, okay? So that's the Venturi mask, high flow device. All right. The next step, we jump from the Venturis, we go into our aerosol therapies, right? Our aerosol devices. And I told you that whatever you put on the end is its name. Aerosol trait color, aerosol face tint, aerosol Tpiece, or aerosol face mask. Okay? They all use the same setup. Now I'm going to show you a couple different aerosol setups, but they're all the same. This one here. This is a aerosol setup. You fill this with distilled water, right? And you have your famous Venturi here. See the arrow, 28%, right? 32, 50, 98. Now look, 98% is almost 100%. Now look at the windows, closed. Pretty much all the way closed. Look at that. The air entrainment, there is no air entrainment. But when I turn this to 28%, look at the windows, wide open, right? Because I'm turning up the flow and I'm sucking in outside air. There it is, wide open. Now, with this device, this is when we need to know total flow, because you won't know what it is until you do the calculations, right? Depending on what you turn the flow meter to, you do that, and you have to take take into consideration your FiO2 and do your magic box. You find your air to oxygen ratio and your total parts, and you multiply those total parts by the liter flow, and that's your total flow, okay? So this is one type. Well, this is another type. Same thing, right? Same thing. Here's an arrow there. You see this white arrow, right? You just turn the knob. And as you turn the knob, the window either opens more or closes more. Look at that. 98%, the windows are closed, right? But if I go down to 28%, they're almost wide open, right? And so on, right? You see 40%. There, see that crack right there? Crack right there and a crack right there. That's all you need to bleed in enough air to bring it down to 40%. So that's how this works. Again, I don't like how they use yellow, because I told you yesterday or in the lecture that some patients just need the humidification. They don't necessarily need the oxygen, so they will still use a Venturi system. But the simple fact that they wrote FiO2s on here lets you know this is for oxygen. And for this to be used for oxygen and colored yellow is beyond me, okay? But so don't let that confuse you. This is for oxygen. Now, quick question. If I have this setup on my airflow meter, right? This will be a quick question for you to think about. If I have my high flow setup, right, hooked up to the air, right, hooked up to the air, what will my FiO2 be coming out of here? No matter what I turn this to, what will my FiO2 could only be? I'll leave that for you and get back with you on the answer. All right? Now, this is another kind. This is another kind, right? This is another kind. There's a lot more water, right? This has a lot more water. This is a 1,070 mLs of sterile water, right? You hook it up. Same thing here, though. See how they all do the same thing, guys? Venturi, right? Just turn it. The doctor says, I want this patient on 40% oxygen. You as a therapist will decide which modality you're going to use. All he needed to tell you, or she needed to tell you, is what they prescribed. If they prescribe 40%, I look at the patient and assess. Will I be able to do 5 liters on a cannula? Will they be able to do that? Or do I need to use a Venturi mask or one of these setups, right? That'll all be part of your assessment, right? If they have a bypassed airway and they have a trach or they have an ET tube, you have to humidify and you have to heat your gas. So then you would have to use an aerosol setup. You have to, okay? If their airway has been bypassed. So let's look. This mannequin here is intubated, right? So that has bypassed his nose. So he has to have an aerosol setup, okay? This one here has a trach collar, right? That's an actual trach. His airway has been bypassed, so he will also have to have an aerosol setup, okay? But this mannequin has his airway, upper airway intact, so he won't need all of that. He can use an aerosol face mask, or if he has some burns on his face, we would then use an aerosol tint, face tint, okay? Aerosol face tint. All right, so let's look at it. All right, so I'm going to hook up. Oh, one last one. This is the one here that you see. It doesn't have a FiO2 on it. This is a gin. This is called a gin Mistiox, right? It's for high flows. When a patient really needs more flow, we can put this one on the oxygen and then hook this one over to the air and get more total flow. This is when you use the formula about the 2 FiO2s and the 2 flows and all of that. This is what you would use. That's what you would use if you're dealing with this, okay? Sometimes your patients will need a tandem. Their demand for flow is so great that you'll have to have 2, right? You have to have this on your oxygen and then this one here on the air to bleed in more flow, okay? More flow. All right. So let's hook it up. So I'll take off this Christmas tree, right? I have to take off the Christmas tree. I will hook this up. Just screw it in. You can zoom in on your camera. And then I'm going to turn it on. Now I have aerosol. I'm going to bring the camera close where you can see the actual aerosol. That's aerosol. Remember, aerosol you can see, humidity you cannot see. Aerosol you can see, humidity you cannot see. All right. All right, so what are all the rest of the components of the high flow setup? All right, I'm glad you asked. So you have the large volume nebulizer, right? That's the Aerosols large volume nebulizer. Then you have to have large bore tubing. So this is the first large bore tubing. It will come in a pack. Notice that these large bore tubings have sections, right? Little smooth sections. This is where you as the therapist can cut, right? And put things in line if you needed to. Like if you had somebody who needed a breathing treatment, you wanted to put it in line, you could cut this and put it together with the breathing treatment, right? Or if it's too long, then you'll just cut it for your own thing, right? Whatever you need to do it for. So this is one corrugated tubing or large bore tubing, right? For high flow system. I'm gonna hook this up here. So the first large bore tubing goes here, right? All right. Then I have to have a drainage bag because that's mist coming out of it, right? That's aerosol. And as that aerosol collects inside of that large bore tubing, it can rain out. We call coalesce, also known as rain out. And when it does, it's going to form droplets of water. You don't want that water to get into your patient's lungs. So wherever the trough is of your system, right? Wherever the trough, right? This little area here will be the trough. For gravity's sake, the water is going to drain into the trough, right? Well, this is where you will put your drainage bag. It's just a simple bag that collects water. It has a little plug here for when it gets full, you can open it up and drain it out, okay? So I have the large volume nebulizer, the one corrugated tubing, the first one. I have my drainage bag that fits on like that. Then I have to put on my second corrugated tubing. My second corrugated tubing goes here, right? Now, this is the trough. See that? If I was hooked up to me, then this is where the water would drain to, right? So that's where I have my drainage bag. Okay? Excellent. Now, so this is your second. Now, what did I say what I'm calling it? This is aerosol what? Whatever I put on this end here is what it's called. Okay? So, what everybody already knows, this is an aerosol mask, right? This is a mask. Aerosol face mask right here. Regular, universal, can be used on so many different modalities, right? This is it. So if I put this on here, this is now a what? Aerosol face mask. Simple, right? All right. Sometimes patients have burns on their face. Sometimes patients have burns or had facial surgery and they can't use a mask pressing down on their face. So what in that patients we would use a face tint. This is called a face tint, right? This will go on the patient like this. Like this. And it just kind of hangs like this, right? So it's not all touching my face too much, right? But the oxygen, I will put it here. And that's an aerosol face tint, right? It's able to just collect right here in this reservoir, and as I breathe, I get the oxygen and I get the moisture, right? This is an aerosol face tint. That's what it's called. All right, well, what if it's a trach patient, right? What if I have a patient that has a tracheostomy? Well, this is a trach mask, right? This is a trach mask. So if I hook this up to the trach mask, I now have an aerosol trach mask, or also known as an aerosol trach collar. Okay, aerosol trach collar. Then we talked about in the lecture that sometimes patients have ET tube, right? So this patient here has an ET tube, right? Well, in his case, before we extubate this young man, we want to see if he can survive off of the ventilator. So what I would grab my Briggs Adapter. This is a T-piece, also known as a Briggs Adapter. That will be a test question. The Briggs Adapter, right? Well, I'd hook the Briggs Adapter to his actual ET tube, right? I have one end of my setup on this side, right? And then I have my little extra piece of all right, let me find the extra piece right quick. All right, we have an extra piece of corrugated tubing. These are 6 inches of corrugated tubing. Remember when we talked about mechanical dead space, I told you each one of these little sections is about 50 cc's of dead space, just so you know. But this is how it hooks up. Matter of fact, I already have a mannequin on this side, so it may be easier for you to see on this side. All right, here we go. All right, can you see them? All right. Make sure you have your patient sitting up well, a nice positioning whenever you're dealing with your patients, right? All right. So in this intubated patient's case, right, I would simply, here's his ET tube, right? He's on the ventilator. I would take him off the ventilator and see before I pull this tube. Because if I pull this tube and he can't make it, then we're going to have to put him back to sleep and back intubated. That's a very, very invasive procedure. Don't want to do that if you can help it, okay? Don't want to do that if we can help it. All right, so for Aerosol Tpiece, we have the same aerosol setup, right? Here's the setup here. You got this one here is going to the actual large volume nebulizer. Then you have your drainage bag, your second corrugated tubing, and your Briggs adapter, right? So I put this Briggs adapter on here, right? One end of my setup over here, and the other end, the little extra piece here. That is a T-piece. It makes a T, right? Aerosol Tpiece. Aerosol Tpiece. Right? That's the Aerosol Tpiece, guys. And the aerosol, I'll show you the aerosol tray collar. This is the aerosol tray collar. Right? This patient has a trach, right? Then I would have him simply with the aerosol, I'll put the aerosol trach mask on him. This is the mask, aerosol trach mask. It just has a snap. Snaps off. Put it around the patient's head and snap it back on this side. All right? All right. So, this is our trach mask, right? You can take it and you can also take the slack out, right? If it's too loose, just take the slack out. Perfect. It just sits right here over the actual tracheostomy, right? Sits just like that. And here's my aerosol setup. Goes to the trach collar. Now I have an aerosol trach collar. All right? All right, so those are your high flow systems. Keep in mind that we talked about the head box. Remember, we have a head box in the lab where the baby has a head box, right? His head is inside of the contraption, and you have a large bore tubing going to the baby. Remember, 10 to 15 liters per minute, because if it gets too high, what happens? The baby does not like it because it's too loud for the baby. Too loud for the baby. All right, so in a nutshell, guys, that concludes what I'm able to do for you here, the high flow and the low flow oxygen therapy lab. This is the oxygen therapy lab. It will be 2 videos because the first video I was doing got interrupted with a call. I didn't have my do not disturb on. So I'm gonna have to try to put them together. It may be on there as 2, so make sure you watch both. But this is the medical gas therapy lab, all right? Now, the last thing I'll leave you with is the Venturi systems that are in colors, right? The colors that we showed you in the PowerPoint. Now, I'm not sure if you're gonna be able to see this or not, but it has the FiO2 and the liter flow. So let's show you, how do you make this yourself? Yeah, we have the Venturi set up if it's already made, right? If they have one that we have that's already been manufactured, right? This one has already been made for us, right? This doesn't even come off. It's glued on, right? But we can make our own. So all we need is a aerosol mask, right? We need a 6-inch of the corrugated tubing, right? We need you a 6-inch tubing, right? So, okay, here you go. Here's your mask. Here's your tubing, your large bore tubing. And, of course, what's going to go here? Our Venturi. All right, so let's look at it. See if you can see what this liter flow is and what this FiO2 is. It's iPhone 11, so I'm assuming you're going to be able to see it. I don't know, I think it's backwards. All right, but you see that 8 liters and 35%. So 35% at 8 liters. That means put your flow meter on 8 liters and you'll have 35% because of these air entrainment port. Okay, so I would put this on just like so. Okay, and then finally my small bore tubing will go here. Now I don't have, of course you would have a cup, but this cup is not for this type. I don't have the cups for this company's Venturi. So for right now, I'm just gonna put this on here like this. Guys, this is your Venturi setup that you made. Aerosol face mask with aerosol mask with a large bore tubing, and whatever FiO2 I'm looking for, I select the correct color. So this is a 35% FiO2. Let's look at the rest of them. Remember I told you you'll see this pink one the most. 40%. So this is saying 8 liters also. But this one is for 40%. And that just means that these windows are a bit smaller. Can't really tell it. It's right microscopically smaller. But at 8 liters, this pink one will give you 40% FiO2. All right, then you got the 50%. Orange is 50%. Go big orange, right? 50%. Can't really see it. But it's at 12 liters. You have to put this one on 12 liters and you'll get 50%. Okay? So that is how you make your own Venturi, right? So if they're on nasal cannula and they get to their ventilatory pattern becomes inconsistent, then we switch over to a high flow device. And usually before we go into our aerosols and all that, we'll just go straight to a Venturi, right? So you would take an aerosol mask, a large bore tubing, you would take whatever FiO2 you want or the doctor has added or whatever you need to get the hypoxia to be no hypoxemia. And then your small bore tubing, right? And this will hook up straight to my flow meter, okay? Straight to my flow meter, and then I have what I need, okay? So we've gone over the low flow systems, we've gone over the high flow systems. And remember guys, the high flow systems are not hard. You just call it whatever you put on the end. But remember, you need the actual large volume nebulizer, right? You'll need 1 corrugated tubing, a drainage bag, then another corrugated tubing, and then to the patient, right? And whatever you put right here is what it's called. So I'm gonna see if you can see the mist coming out. Comes out so fast that it's hard to see. Hard to see. Can you see it? Against the background. Let's see a dark background. See it? I can see it. It barely can see it. See that? But that is all that they need, right? Remember, aerosol you can see, humidity you cannot see. Aerosol you can see, humidity you cannot see. All right? All right. So that is the lab for medical gas therapy. Everything that we have gone over. The low flow systems, the high flow systems, the Venturi setup, and how to set everything up. Guys, I hope this lab or this video helped you. I hope it helps you with your what we got going on. Of course, we'll be happy when we are back together. It'll be a lot easier when we're back together. But for right now, we have to do what we have to do, right? So I came up here to try to record something for you guys to have in the future. And future students can always have this available. even when we get back into school, guys, I'm gonna start coming up here and recording the actual lab. So that way you guys or students will always be able to go back and look at each individual lab and how it's performed, so that when you know, later on, if you haven't seen some of this stuff in a long time, or you get to 220 and it's time for practicum, then, you know, you can look at the video and brush up on it before you get to practicum, okay? So it'll always be available for you if it's okay with the school. I will be doing that, okay? So stay safe, and I will see you this evening for lecture.